Thank you, listeners, for returning to Mastering Counseling. We're so happy to continue our show today with Keith Kurlander, who is one of the co-owners of Integrative Psychiatry Institute, which we'll often refer to as IPI, and has had a private practice in the past and is doing a lot of really innovative things for mental illness. Thank you for being on our show today, Keith.
Yeah, thanks. It's great to be here.
Um, we have a lot to cover, and I know the Institute is doing a lot of newer types of treatment, and I can't wait to hear all about that. Why don't you tell us about your early path in mental health and how the Institute came to be founded?
Sure, that's a good starting point. I graduated from Europa University's counseling program in 2005, so a while ago, and went straight into private practice thereafter pretty quick. And I had a pretty diverse focus. I was trained pretty extensively in Gestalt therapy and more depth-oriented psychotherapies, and then I also, alongside of doing that kind of work, was suffering with my own mental health challenges
Mm,
um, quite a bit on and off in my adulthood. So my my sort of view on mental health was not only sort of theoretical, I could say,
mhm.
or professional. It was also personal. So
Yeah,
like many people struggle with mental health. I'm not
mm,
alone there.
for sure.
And more and more. So that unfolded, and being in private practice was great. I learned a lot. And then eventually myself and my colleague and friend, we decided that we wanted to have a larger impact. We were learning a lot about ways to help people that wasn't being taught in graduate
Mm,
schools or many counseling programs. And we really felt like we wanted to impact the field in a larger way and get
mhm,
other really powerful treatments and interventions to clients and patients. So we formed the Integrative Psychiatry Institute, which is an educational institute for professionals. We
mm,
started with a integrative psychiatry program to really help psychiatrists get more well-rounded outside of medication management only treatments,
mm.
and into all kinds of things like alternative medicine and uh, supplements and a lot of different treatments, looking at the body as a whole,
Mhm.
how systems work together, and a good focus on trauma psychology and looking that as a root cause. So the institute was founded as a way to really focus providers on understanding the spectrum of root causes
Mm,
of what our clients are dealing with.
mm,
And then we, pretty soon thereafter, this is both a personal history of mine, but professional interest, was getting more and more interested in psychedelic therapy and what's been emerging. And the
mm,
Institute has grown to be probably the world's leader in training psychedelic therapists,
mm,
train about 700 to 800 a year in a pretty extensive year-long training,
mhm.
where we go through the three main medicines that
Okay.
will likely be used in the next handful of years.
Okay.
Um, and that's really my focus now. I run the institute um, with my other co-founder, and we have a ketamine psychiatry clinic where we treat patients. We've got a psilocybin service center in Oregon,
Mm,
um, and we're really focused on s- training this new modality that's really, going to be kind of the fifth wave
okay.
of psychotherapy.
Wow. That is all so fascinating. Yeah, we haven't talked too much about these types of treatment, so I'm super thrilled to hear more about that. I have heard on another show how Colorado, that's where you are, correct?
Yeah. Yeah.
Yeah, that Colorado seems to be kind of a hub for this type of exploratory learning, and I'm sure a lot of it has to do with your institute. Any thoughts on, why there, or is it mainly from your organization, or why do you think so much is coming out of there?
Colorado is the Wild West. So Colorado was one of the first states, I think the first state to um, bring recreational marijuana at the state level, not just medical marijuana. Colorado, it's a political atmosphere in Colorado that is what you're referring to. So Colorado, there's enough political mindset in Colorado to be thinking differently about some of these things. And so psychedelic therapy, I mean, psilocybin was decriminalized in Denver, but that's not really what we're talking about. But psychedelic as a therapy, using psychedelics as a therapy, passed in Colorado. And so we will see psychedelic psilocybin therapy in the summer of 2025 in
Mm,
Colorado because they're just writing the rules right now.
okay,
Oregon was the first state to pass using psilocybin as a personal development treatment, but
okay,
Colorado is the first state to pass it as a mental health treatment. So
okay.
it's yeah, Colorado's just sort of on the cutting edge of,
Mhm,
I think, politically, which causes these things to pass here.
mhm. Um, Thanks for giving us kind of that overview, and I'll probably need help pronouncing the second drug that you mentioned. But let's talk a little bit for our audience about the ketamine. I think that's how you say it, right? The ketamine use of that, and how does the science of that treat patients, and how can it help your clients?
Yeah, that's a good question. So let me just start a little higher. There's three main medicines to be aware of right now. That's ketamine, MDMA, and psilocybin. Ketamine we'll start with. So ketamine is been around since the 70s, not as a mental health treatment, um, as a anesthetic to sedate people during surgeries at first in the battlefields,
Mm,
to either dissociate them from their pain, or now that they use it in pediatric medicine all the time to dissociate children from minor uh, outpatient procedures.
okay.
Um, but what got discovered um, really in the um, early 2000s to mid 2000 to 2015, a lot of research started getting done around using ketamine in low doses for depression, treatment resistant depression.
Okay.
And it turns out that ketamine in low doses is quite amazing with treatment resistant depression.
Mm,
Nearly 70% of people who get ketamine treatments with treatment resistant depression, um, their symptoms get cut in half after one session.
mm,
So, and also people who are suicidal, their suicidal ideation can go away in one session after
mm,
months or years of suicidal ideation. So ketamine was not thought of necessarily as a psychedelic, but it was also obviously used recreationally. Um, a lot in the 90s, but it still is, because it does have psychedelic properties. And so what also happens, so when you use ketamine for treatment resistant depression, there are biological things going on. There's biological mechanisms that aid in reducing depressive symptoms, but there's also a psychedelic mechanism that isn't often talked about. So when you pair that session, that treatment with a therapist in the room, and you do psychedelic therapy with proper preparation and integration and all of these things, you can really amplify the effect. Because psychedelics, some of them have biological properties that help us with these issues, But the psychedelic itself, the psychedelic properties really allow us to do a number of things from, unrooting trauma and working
Mm,
through trauma in a session, um, from uh, creating new meaning, new narratives that our default mode networks wouldn't allow us to do previously. And we can create new generative meaning within sessions. So psychedelics can really speed up the process very quickly when it's appropriate. So that's ketamine. So ketamine is mainly used for treatment-resistant depression. There are other uses of ketamine. It is currently used off-label in most settings, meaning that it's generic ketamine and it gets prescribed by a prescriber, and it's not indicated for treatment-resistant depression. That's not what the original um, studies were for. But there's enough data now to support that it works really well for that. So that's ketamine.
yes. Wow. No, thank you so much for that's basically mini education. Because I think with it being such a new thing, I know some therapists are aware probably where they are, who they network with, but a lot of people, and a lot of people who listen to the podcast are new to this whole field. So that was a really good explanation. Um, while you were talking, I had so many different thoughts, and I want to talk about the other two medicines as well. But I'm guessing your institute must work very close with medical doctors, um, and hospitals and that type of work as well. Can you talk to us about that?
Yeah, I mean, our institute is mainly focused. I think the best way to think about our institute is it's a continuing education institute. So the institute is really there to train people in a modality. And we do other trainings too.
Mhm.
So we have a large network of places that people come from to
Okay.
get trained. And a lot of people are in private practice who get trained, but many are not.
Okay.
Psychedelic therapy is starting to move into healthcare systems now. You can find ketamine therapy in some mental health centers. Um, it's slow arising in those spaces, but it's happening.
Mhm.
Uh, you can see people using ketamine therapy in the ER for treatment-resistant depression sometimes,
Okay.
suicidal thinking. So it's emerging more. But a lot of people, find us because they're getting interested in
Mhm.
wanting to know more. What is this about? How do I get involved with
Mhm.
this new modality? That honestly, there's the buzz about it is mostly really real and positive. I mean, there's obviously things to be aware of and cautions, but I think as a whole, we're going to see really great things from this modality over the next 10 years.
Um, yeah, especially in regard, I feel like to suicidal ideation. I feel like sometimes with certain clients, it's just so many years of struggle and that are willing to try maybe I don't want to say trendy, I feel like that minimizes it, but willing to try a more exploratory type of treatment. So that is so interesting. Um, let's talk about if you feel like it's probably a different approach, the other two medicines. I'm going to try to say the one, psilocybin,
Psilocybin. Psilocybin.
psilocybin. Okay.
Yeah.
Talk to us. How is that different than ketamine or used in a different way?
Yeah. So ketamine, psilocybin, and MDMA. MDMA is the medicine that is closest to approval um, for psychedelic assisted therapy. It is currently under review by the FDA after completing a phase 3 trial recently. And the answer will be given by August 9th if it gets approved, and it most likely will.
Okay.
So MDMA is likely going to get approved for psychedelic assisted therapy this year. Psilocybin is not as far along, but it's pretty far along. Psilocybin, which is called magic mushrooms or different names, but it's it's in it's in phase 3 right now, and if that all goes well, probably the earliest would be 2027 for an
Okay.
approval. But
Okay.
there are state initiatives going on
Mhm.
that are using psilocybin services. So there's other ways to look at that. But so we have MDMA and psilocybin. So MDMA is the indication is PTSD, and it works really well for PTSD, doing MDMA assisted therapy.
Mm.
Um, about 70% of people um, after a treatment series on MDMA will get better.
Okay.
And these are treatment resistant um, people who have tried it, everything under the sun.
Yeah.
So it works really well for PTSD. And then psilocybin is more so the focus on the research is depression. There's other aspects of psilocybin research that's worth noting. End of life distress is in the research right now. That's looking very strong. So that's another piece I think we'll see. Um, so they all have different applications and work a little differently. And the psychedelic experience, these are three very, very different psychedelics.
Mm.
The psychedelic experience is very different between all of these three medicines.
Mhm.
And working with them as a practitioner, you need to understand the differences and how to work with your clients um,
Mhm.
eh, under these different medicines and how that all works.
Mhm. Um, Very interesting. Thank you for I feel like when you explain it, it makes it seem a lot more comprehensive. I was thinking about if you were a clinician and using these methods, would the drugs be used only in the session, or is it like something you practice with the client in session and then they would use at home as well? How does that work?
This is a good question. So it's a little bit of a nuanced answer. So MDMA will be in the session. It will be highly controlled. Um, we don't know the rules yet on MDMA, which we'll know in August likely,
Mhm.
but it will be controlled. It'll probably be at some centers that are allowed to distribute it during the session. Um, Ketamine is different in that you could go online right now through an online telemedicine service as a patient and get prescribed ketamine.
Okay.
But our philosophy as an institute, my personal philosophy is you want a therapist with you when you're doing these things
Mhm.
because um, the material that gets surfaced if you're alone could first of all be traumatic.
Mhm.
Um, if you have trauma surface, which happens a lot,
Right.
old trauma, and you're alone, um, that's can be re-traumatizing. I mean,
Right.
we know that one of the ways that it's really important to heal trauma is through social connection. So having that other co-regulator in the space with you. So our our way of teaching and the way you're going to see most of this come into the field more and more is there's going to be a therapist in the space.
Yeah.
Ketamine is largely being practiced that way
Okay.
at this point, but it's a very nuanced thing. There's anesthesiology clinics that don't do it that way. That just they put them in a room alone with the ketamine. There are at-home teletherapy services. So there's a lot going on in that space.
Okay. Wow. Yeah. That it's I do hear the word caution coming out with what you're saying because um you I feel like you just have to be very serious about looking at the background of your clinician and I feel like it could get really gray, and you would want to make sure that they were very well trained. So let's talk about the training that someone who had a private practice and they wanted to come to you. How does that look as far as time, training? Is it online, in person? Do you have a supervisor? Talk to us about that.
Yeah. So our training's a year and it is 90+% online. There is 1 to 2 in-person events depending on what you choose. Um, it's a whole combination of different learning activities. We have, a lot of asynchronous material that's happening that you're studying. We have weekly live online material that's required. There are different formats for that. We have large room learning, 100, 200 people in a Zoom where they go into breakout rooms and you're doing exercises and experiential exercises and things, and you're discussing video recordings that you've watched of people on these medicines and therapy sessions. We have small groups, where what you're talking about, which has more of a feel of getting more mentored, from it's called home groups facilitation. And
Okay.
then we have a in-person practicum that everybody comes in small groups out to Oregon to practice with psilocybin. Um, and we have other companies that we own that the students, if they want to, can engage those other companies so they can actually experience psilocybin. Um,
Okay.
and so there's observation going on, there's practicing, and then we have a ketamine practicum, which is optional, where you can come out and experience ketamine and practice with that. So there's other nuances and exams and all kinds of things going
Mhm.
on in there. We have 30 to 40 faculty teaching in this program.
Okay.
Um, and we've been really fortunate. I mean, we have all the thought leaders in the space really teaching in our program.
Okay.
So it's super interactive and fun. Obviously, this modality is challenging, but it's also fun. It's very dynamic and
Mhm.
exciting.
Yeah.
But it's for clinicians who are ready for that. I mean, working with clients on these medicines is very different than ordinary state consciousness therapy. You
Mhm.
know, people can go through a lot, and clinicians really have to want to do that work.
Mhm.
You have to really be able to sit with a lot of intensity,
Right.
and
Yeah.
it's exciting if you can, because there's such rich things that can come from those
Yeah.
sessions.
That makes me wonder, typically a lot of counseling sessions are 45 minutes to an hour. I mean, I know a lot of people are doing, weekend intensives and things, but um with this type of treatment, are the sessions longer because of the use of
Mhm.
the drugs, and talk to
Yeah.
us about the time frames.
Yeah, ketamine is a 2-hour session typically. MDMA and psilocybin are typically a 6-hour session. So they're long.
Wow.
They're a whole day if it's
Yeah.
MDMA or psilocybin.
Wow.
With MDMA or psilocybin, you'll usually have a co-therapist, particularly MDMA. We'll see how psilocybin shakes out over time.
Mhm.
Um, so they're long, and it's a deep dive
Yeah.
for those hours. And sometimes you're sitting in silence for a long time.
Mm.
The person's just internal, and the work happens when they start coming out of that
Wow.
space. So a lot or a little can happen during these times.
Yeah.
And
When
yeah,
they are under the influence of them, is it, are they do they ever feel like to the therapist like they're completely asleep, or is it like you're in that in between state of consciousness, or are they ever completely out?
well, some people. So each medicine's different. Um, Ketamine, because it's a dissociative, you could I mean, you might not, people can fall asleep, but
Okay.
more so you might be like, where is this person? And this is where training comes in of
Mm-hmm.
like, knowing how to know that everything seems to be fine and you have to give them their space, or just, this is where the training comes in.
Yeah.
It can get uncomfortable when you're like, are they here? Are they in the room? What's going on?
Mm-hmm.
They're probably not in the room consciously a lot with ketamine because they're,
Yeah.
dissociated from their body.
Mm-hmm.
MDMA is different. MDMA sometimes is more verbal.
Okay.
People want to connect more, but it can also be very physical and a lot of sensation.
Okay.
Psilocybin is a classical psychedelic, like hallucinations and all kinds of things like that. And
Mm-hmm.
it can be all over the spectrum, really.
Mm-hmm.
Yeah.
That is so interesting. As a person who anytime I've had anesthesia or, for surgeries or I take Sudafed, it affects me. I hardly take any of it because
Yeah.
I'm like, I can't even imagine. I'd probably be out for 2 days.
Right.
But, yeah, there's just so many factors, to that. And it's good to hear that sometimes you would have a co-therapist, because it is, it's just a definite different state of mind. And like you said, the person can be more physical. Um, is any part of the training, like, does a person ever begin to reenact or feel violent or no, if they're going through a past trauma?
It's very rare for someone to get violent.
Okay.
I can't say it hasn't happened,
Hmm.
but that's very rare. If you look at the research, you don't see that very
Okay.
often. It can happen, but that's rare to actually get physically violent.
Hmm.
But people can reenact some things,
Right.
and do things that, you wouldn't expect to see in ordinary therapy. And it would just like immediately be like, that can't happen here. What are you doing over there? Like, people can do things. They can touch their bodies in ways, and you sort of have to be really trained on this stuff because people are under the influence of a very powerful psychedelic, on
Hmm.
the ethics of this work. But mostly what's happening, I mean, again, like almost all the time, is like people are just really getting in touch with deep psychological insights, doing a lot
Hmm.
of somatic releasing, processing memories, processing their identity, and processing the meaning they have in their life. And that's the majority of what's going on in a psychedelic therapy session.
Um, you've taught us a whole lot in this short amount of time. I'm sure you feel like we barely skimmed the surface, but I know I feel like I've learned a lot. What would you want, maybe we'll think like a broader scope and then more focus on this type of therapy, but people just generally going into the mental health field, what would be some advice you would have for our listeners?
Well, I'll go broad first. I think that when you're entering the mental health field, and let's say you're going to be a counselor of some kind, I think it's really important to be asking the question, what are the root causes of people's struggles? And getting very educated on the wide spectrum of what those could be. I think that's essential because wherever you go to school, and whoever your supervisors are, like, they're going to have a narrow view of what those are. They're not going to share all of them and go really deep into all of them. And so it's really important to just get a really good education on what all those causes are.
Mhm.
Then it's really good to specialize in helping people solve one or many of those causes. Trauma, for instance, which is one of the most ubiquitous root cause of any mental health disorder, um, I think is essential for any counselor to have a very, very deep understanding of trauma,
Mhm.
um, because it's almost there every time. There may
Yeah.
be other root causes, but that one is going to probably be there with someone struggling with significant mental health issues. So that's what I would say. And then the other thing I would say is, I would be paying attention to psychedelic therapy.
Hmm. Oh, go ahead.
I would be paying attention to psychedelic therapy because this modality is coming in a big
Hmm.
way. There's no doubt. Um, the pharmacological interventions we've had are not great. They're okay. They've helped
Hmm.
a lot of people. They've helped me at times, but they're not great. And psychedelic therapy is going to be a major component in of a modality in terms of what's going to be around and available and what people are going to be using. So I
Yeah.
would pay attention, and I would,
Yeah.
if you're curious about it, I would get trained because a lot of people around you are going to be trained within the
Hmm.
next 10 years. I mean,
Hmm.
that's going to happen. And it's a really dynamic, different way of working.
Right.
But you probably wouldn't only be doing psychedelic therapy. That's a lot. You're not going to be doing 20 hours a week of psychedelic therapy.
Mm.
That's most people won't be. Some would, but
Okay.
that's a lot to do.
Yeah. No, that's a good point that you make, that if you go that route, or if you are trained that way, but that you still may be using other forms to help your clients. So,
Yeah.
um yeah, is there anything that you feel like we didn't cover that we don't have a whole, I don't want to keep you too long, but anything that you really feel you'd want to share before we close out today?
Let's see. I would just say to the so I would say to the listener that uh, I think that we can box in what we think mental illness is to these disorders that we only know about since the 1960s and 50s, that
Hmm.
we categorize these disorders, and that's helpful to some degree. This categorization process in the DSM, it can help, but it tells us nothing about why they're dealing with those symptoms.
Hmm.
Nothing. And I think that the more we can keep trying to look at what these signals are telling us, these symptoms in the body, what they're telling us, where they're coming from, we're gonna help more.
Hmm.
Um, and the symptom suppression model that arose from from focusing too much on diagnosis isn't working. We're not. We have way too many people getting more and more treatment resistant over time.
Hmm.
So we really need to focus on the root cause model of mental health issues and help people with the causes of their pain.
Yeah.
So that's what I would leave people with.
Yeah. No, it's very heartfelt. Thank you so much. You are doing a whole lot of work of a huge organization that's kind of leading this cutting edge modality. And so we really are thankful for your time that you would share on mastering counseling. So thank you for giving that to us and for all the information you were able to share.
Yeah. So thanks so much for having me. And people can come visit us at our website, psychiatryinstitute.com, see what we're doing. We'd
Yeah,
love to
no.
connect with you.
Yeah, thank you for mentioning that. Yeah, because I'm sure people are going to be very interested and want to ask more questions. To our audience, I hope that you do continue to ask questions. Check out the website for IPI, and they have podcasts on there as well. Please leave us comments and questions for the future episodes. For today, we're signing off of Mastering Counseling. Have a wonderful day.